Hi, my name's Scott Archer. I'm a nurse practitioner and I'm currently working with Evercare, which is a subsidiary of Optum Healthcare and United Healthcare. And what I do is long-term care. So I go to different facilities. I graduated from the University of Washington in 2008. I took the ANCC exam for adult and geriatrics, so I'm dual certified. I'm going to be granted the new certification. So while I was at the University of Washington, I did the adult and older adult nurse practitioner program. They were extremely instrumental in helping me get to where I'm at today, without question, and so were a number of other really great professors at the university. It was a great experience at the UW. Some of the clinical sites I got to go to were my first clinical site for nurse practitioner was at the state prison up at Monroe. And there I worked with a family practice nurse practitioner seeing prisoners. And it was a really great experience. It was a complete outpatient. Then I got an opportunity to do a hospitalist clinical at Stevens Hospital up in Edmonds. And there I worked with a PA and a really, really great group of hospitalists up there. It was a little intimidating at first, but trust me, everyone can do it. It was a lot of work, and they treated you just like you were a staff member there. It was great. It was really a great experience. And after that, I did a clinical with Group Health with their long-term care service. And then I did my last clinical with the University of Washington Harborview's long-term care service under a nurse practitioner named Steve Felton. That was my preceptor. And by doing that, I got the opportunity to get a job with them. It was something that I wouldn't trade if I had to do it over again. My master's project was, I worked with Cindy Doherty and Bonnie Still at the university and at the VA, and it was a cardiology and pulmonology type study, and what we were looking at was fall prevention and how to keep folks from falling and occurring the injuries that come with that, especially when you have very severe lung or heart disease. But yeah, in this job, you'll see people, in long-term care, believe it or not, I have people in their 20s who've had severe accidents and now they're living in long-term care, and up to 113 years old. And I can tell you, every time you get to take care of a person over 100 years old, it's an honor. I've been a preceptor for the last three and a half years, almost 4 actually. I enjoy taking students. It's a way of giving back, because people certainly took me. When you get done, if you go through this program and you finish, I would tell you to seek out a preceptor opportunity, because you really, you get as much out of it as the students do, I think. Because they challenge you, they're smart, and they make you think about the physiology and the anatomy and all that fun stuff. And the University of Washington was a huge door for me, and fortunately they swung it open, and I'll always appreciate it.